Acoustic neuroma causes, symptoms, diagnosis, and treatment. An acoustic neuroma, also known as a vestibular schwannoma, is a non-cancerous benign tumor that develops on the 8th cranial nerve, vestibulocochlear nerve, which is responsible for hearing and balance. This nerve is located in the cerebellopontine angle, a region between the brainstem and cere. One causes. The exact cause of acoustic neuroma is not fully understood. However, several factors may play a role. One causes genetics. A family history of acoustic neuroma or certain genetic syndromes like neurofibromatosis type 2 NF2 significantly increases the risk. NF2 is a rare genetic disorder that causes multiple tumors to grow on the nervous system. One causes radiation exposure. Exposure to ionizing radiation, such as from radiation therapy for cancer, can increase the risk of developing acoustic neuroma. Unknown factors. Most acoustic neuromas occur spontaneously, without any clear contributing factors. 2 symptoms. Symptoms of acoustic neuroma can vary depending on the size, location, and growth rate of the tumor. Common symptoms include hearing loss. This is the most common symptom, usually affecting only one ear. Hearing loss can progress gradually or appear suddenly. 2 symptoms. Tinnitus. A ringing, buzzing, hissing, or other sound in the ear, often experienced alongside hearing loss. Dizziness and balance problems. These can range from mild vertigo, a feeling of spinning, to difficulty maintaining balance and coordination. 2 symptoms. Headache. Headache is often described as a constant dull ache, usually on one side of the head, and can be accompanied by nausea and vomiting. Facial weakness or numbness. This occurs when the tumor presses on the facial nerve, leading to weakness or paralysis of the muscles on one side of the face. 2 symptoms. Other neurological problems. As the tumor grows, it can put pressure on nearby structures, leading to symptoms like slurred speech, difficulty swallowing, and visual disturbances. 3. Diagnosis. Early diagnosis of acoustic neuroma is crucial for successful treatment and minimizing potential complications. The diagnostic process typically involves clinical examination. A thorough medical history and neurological examination, including a hearing test, are conducted. 3. Diagnosis. Audiological testing. Audiometry, which evaluates hearing ability, is used to assess the extent of hearing loss. Imaging studies. 3. Diagnosis. Magnetic resonance imaging. MRI. MRI is the most accurate imaging technique for diagnosing acoustic neuroma. It provides detailed images of the brain and surrounding structures, allowing doctors to determine the tumor's size, location, and extent. 3. Diagnosis. Computed tomography. CT scan. While less sensitive than MRI, CT scans can also help detect acoustic neuroma. 3. Diagnosis. Magnetic resonance imaging. MRI. MRI is the most accurate imaging technique for diagnosing acoustic neuroma. It provides detailed images of the brain and surrounding structures, allowing doctors to determine the tumor's size, location, and extent. 3. Diagnosis. Computed tomography. CT scan. While less sensitive than MRI, CT scans can also help detect acoustic neuroma. 4. Treatment. Treatment options for acoustic neuroma depend on various factors, including the tumor's size, location, and the patient's overall health. Observation. For very small, slow-growing tumors that are not causing symptoms, observation with regular MRI scans may be the recommended approach. 4. Treatment. Surgery. Surgery is the primary treatment option for most acoustic neuromas. The goal of surgery is to completely remove the tumor while minimizing damage to the hearing and facial nerves. 4. Treatment. Stereotactic radiosurgery. SRS. SRS is a non-invasive treatment that uses highly focused beams of radiation to destroy the tumor. It is often considered for patients who are not surgical candidates or for tumors that have recurred after surgery. 4. Treatment. Radiotherapy. Radiotherapy may be used to control tumor growth or reduce symptoms in certain cases. Important notes. Acoustic neuroma treatment should be managed by a neurologist or neurosurgeon specializing in brain tumors. Early detection and treatment significantly improve outcomes and minimize the risk of long-term complications. Important notes. Regular health checkups, especially for individuals with family history of acoustic neuroma or NF2, are crucial for timely diagnosis and intervention. Conclusion: acoustic neuroma is a serious condition, but it can be effectively managed with early diagnosis and appropriate treatment. Seeking medical attention promptly is crucial to achieve the best possible outcome and preserve hearing and balance function.